everybody. Reporting to you again from the Glamour City, Hollywood.
In the homes, when COVID hit, if my patients don't receive, skilled care from my nurses, they have to go back to the hospital. Well, guess what? The hospitals were closed. So we went literally in chaos mode at the time that country shut down, and I was 24/7 on call with my entire leadership team. And all we did is prevent, and make sure that we're providing 100% support to the nurses that were willing to take the risk and the patients that were willing to receive the nurses at home, because that was another issue. Sometimes the mom and dad didn't want to receive the nurse because at this point you didn't even know what COVID was. But at the same time, if they don't receive the care, who is going to do the trach change? Who is going to do the things that the parents are not trained to do? And it was super challenging, I think. During chaotic times like COVID, you really understand the dimension of what leadership is. And it really challenges you not just to go above and beyond, but exceed that, because there is not a if, it is a must, and you have to be ready to.
If you love listening to this show, please consider giving a rating and a review on Amazon Alexa or wherever you listen. We want to continue bringing you this amazing content, and part of our ability to do that means that we need a big audience. Now, it may not seem like much, but rating and reviewing the show will help more people find us, just like how you found this show. Simply on any podcast platform, search for a show, scroll down to the bottom, and push 5 stars. It's that easy. Thanks for supporting the show. Today, I'm joined by Greice Murphy, founder and board member of Advanced Care Partners. She's also an advisor, investor, and philanthropist. Welcome to the show today.
Thank you so much, Scott. Pleasure to be here.
So you moved from Brazil to America to work as a currency trader for a finance firm in Atlanta. Can you tell us about that?
Yes. So I was finishing my MBA in Brazil, and I got the opportunity to be recruited to come to the United States as I defined the best country in the world, and came here with no English, no friends, took the chance to come and my shot of the American dream, and never left.
Amazing. Now, actually, that brings up an interesting point. Is a currency trader, you still have to, speak English and write English. So how did you manage that in the initial aspect?
The interesting part is I came to America to do currency trading with Brazilian banks. So at that point, we had about 45,000 Brazilians living only in Atlanta. So my territory was Atlanta, and I came to work for a Brazilian who had almost like a Western Union type of bank back in 2010, 2003. That was really big deal. Now you have other ways to send money to countries such as Western Union and even through the banks, but back then it was not like that.
Yeah, actually, that's really interesting because in some ways you were actually in the early stages of what we call fintech. And you were talking about remittance and transference of wiring of money to Brazil, which is very common. And certainly there's a lot of money flowing out from the US to South America, Central America, for instance. Now, how did you go from currency trading to something else and then eventually to starting your own organization?
Yes, I really wanted to get out of the Brazilian community so I could speak more English and learn more about the American culture. When you come from your own country and you stay within your own culture, it's hard to get the best experience and expedite your growth. So I forced myself out of my comfort zone to be able to grow.
And we're going to hold on to that concept because I think that's a really pivotal point that you mentioned, which is this notion of striving, but also constant transformation. Now, you said something earlier, which is at that time in Atlanta, there wasn't a huge Portuguese community per se. So I wonder how you were able to broaden that, and what are ways that you transform yourself so that you could, in fact, be more immersed into the U.S. culture?
Yeah, what I have learned, Scott, is as you grow personally, as professionally, you have always to be pushing yourself to your limits. Otherwise, you become very comfortable and you stop growing. So I have always been a life learner, and I love to continue not just to excel, but to learn new skills. So every time that I get to a skill set that I mastered, I immediately just pivot and go somewhere else so I can continue to develop other more flexible skills as we grow. And it's important, especially for CEOs, when you're scaling a company, and, there is a season for every CEO. And if you wanted to be a CEO of many seasons, you have to continue to develop yourself much more ahead the game than the company. Otherwise, the scalability and the growth of the company will come and catch you, and then you may become irrelevant. So, you have to continue to develop yourself first and then develop the company after.
I think there's a lot of wisdom in what you just shared. And, one of the challenges as you keep moving up, and at some point you're the chairman and CEO, is the fact that you start to stop getting feedback. There isn't this kind of 360 feedback, and things that get filtered to you are kind of, not so bad news, maybe kind of filtered and refined. So you don't get that feedback. So I wonder, how do you go about making sure that you're sharpening the saw with maybe other CEOs and leaders?
Yes, I think using a value-based, people-centric leadership is very important. You cannot take your finger off the pulse, because otherwise you lose, the understanding what's really going down in your company and what's really happening. Culture to me is what people are talking, within the organization. Is you have your fundamentals, you have your core values, but the conversations that go around is really what defines your culture. And you do have to be embedded into your people so you understand what's going on. In my case, it's such a challenging business because it's home healthcare. So 90% of my people are not in the office. I don't get to interact with my nurses every day, or even my patients, because, they're not like in a hospital or in a clinic. So making phone calls, I would take 1 or 2 days per week and 2 or 3 hours per day on those days, just to pick up the phone and talk to nurses. Hey, this is Greice. I'm at your orientation. How is it going? What can we do better? How can we continue to improve and offer you the environment that is ideal for you to work at? As a leader, as a CEO, your responsibility is to provide those safe environments where everybody can thrive. And it's not always the case. So the responsibility of the leader is to make sure that you listen to your people, but make sure that you're available to take the time to go and reach out to them. When you're above 1,200 nurses, it's hard, but you have to understand and accept that you're never going to know everybody at the level that you wish, but you can start every day from, a little bit and continue to do and be consistent.
So we're gonna get into advanced care partners in just a second, and thank you for that overview, because that really kind of sets it up. But there was one more question I had, which is, so far I think that thematically we've been talking about really this notion of constantly acquiring new skills, sharpening the saw, and culture. And speaking of culture, even in your family life, there is a bit of rigor, right? And I think that you use something called high definition destination. And given the fact that your husband's a former F-15 fighter jet pilot, there's a lot of discipline in the family household. And I wonder if you could tell us a little bit about that.
Well, I will say that discipline is nothing more important than love. You got to be disciplined, especially when you have kids, small kids, that you can provide an environment that they know what's going to happen, that they can predict, and that creates a safe environment for them. So even in business, or as a mother, or as a leader, you predetermine where you want to be. Doesn't matter how you're going to get there, but understanding where the final line is, it's super important, especially when you're leading others, because it gives them the clarity and the understanding that no matter how we're going to get there, because you have to be flexible along the way, but the final line is there. And I think everybody that is under those type of leadership understands and appreciates that type of approach.
And I think you bring up a really great point, is that many times, many CEOs, or really some of the executives, there's so much kind of secrecy. There's a bit of kind of hidden information where it's sheltered from the rest of the staff or the members. And you're talking about transparency and making sure that there is clarity and they're clear in terms of where they stand, what needs to be done. And there's less ambiguity is really what we're referring to. Let's get into the organization you started, why you started it, and what is Advanced Care Partners.
So the Advanced Care Partners is a home health care that serves medically fragile children and adults, but majority of our patients are children that are covered by Medicaid. So a lot of people don't know the what's offered in this country, which I come from Brazil, so I appreciate more than anybody that when you have a medically fragile child, which means that child requires a special care in order to survive, like respiratory care, like ventilator, G-tube, CVLs, you name the conditions, it's very rare conditions, you're entitled by law to receive services like what I do, nursing care in their home for free, regardless if you have low income to meet income by Medicaid, you still have waivers that gives you the ability to receive care from providers like me to your child, sometimes for a lifetime, depending on the qualifications. So I got exposed to this type of business by knowing a CEO in Texas that was doing that in Texas, and I fell in love with the mission. I fell in love with the changes that were able to impact this most of the times unprivileged families. And, you think about sometimes we're the only hope that these people have during the day to take care and to have quite a normal life. So the mission is more than anything. And the nurses that serve these patients are the most incredible, passionate human beings you can ever find. So, when I looked into the business model, I not just fell in love with the opportunity to serve, but I also fell in love with the way that you can scale that pretty quickly if you have the right basis in place.
Now, it's interesting because I think in the last 20 years, this home assisted care facility or service, I should say, has really grown rapidly. And I wonder if some of that is reflective of the demographics, aging demographics and baby boomers, but also, how is that market not met? Or maybe previous to some of your services, what were people doing before that?
It has always been there, but had never been as popular as it is today. Like you mentioned, the baby boomers, the home health care for them is a little bit more into your ADLs, your normal daily activities, where our care is very specialized. There are high acuity nurses and services that we provide. But as you know, medical services are moving more in the homes versus being an institution such as the hospital and clinic, especially after COVID. And the shortage, you talk about constraints on the business, the shortage, not just to have enough nurses to supply the demand is super high. And the more we continue to grow as a society, I don't see that issue going away unless we involve the entire community to help these patients or these folks that need help in the home.
There's a lot of moving parts here, right? So I think the fact that as we age and go to different stages of life, many have to confront the fact that they have to potentially live in a assisted community. Right. With their spouse, if they're still surviving, for instance. But there's majority of the elderly that prefer to have the dignity and the freedom to stay in their own home. And that's a really important distinction. But yet they want to have the same level of care. And certainly their kids are going to want that as well. And that's hard, right? And so talk a little bit about the economics and the reimbursement aspects and how this fits within Medicare or Medicaid.
So the Medicaid, we're 100% funded by the government. The patients pay nothing to us. So it's all contract-based with Medicaid, and each state has its own regulations. On the Medicare side, a lot of these patients also come out of pocket because it's not fully covered by Medicare, or they sometimes is even private pay. So if you think about the complexity of running a business where You have nurses that needs to be hired, need to be trained, need to be supervised, needs to be, in touch with all the other medical care, such as the physicians, the pharmacy. Then you have their schedules, then you have the schedules of the patients, the conditions of the homes of the patients, and the locations where they live towards where the nurses live. So you have not just to match skills, you have to match what time do they want the shifts, what services they want, if the skills are necessary or not, and also the transportations to get the nurses there within a ratio of 10 miles or even less, because you don't want your nurses to be traveling all over the state. And then you have to keep everybody happy at the end of the day. So it's, and then you have the insurance issues that you have to be on top of your prioritizations in order for you to run a business efficiently.
So we're going to unpack a lot of that, and that's kind of the nuts and bolts of what I was hoping to cover. But before we go into all of that, let's talk a little bit about before COVID, during COVID, and then after COVID. Because when we think about COVID, I think disproportionately, it really impacted those assisted living communities. Again, just to be clear, not those where nurses were coming to their homes, but they were part of a community where they were living with others. And they were disproportionately affected by COVID more so. And certainly there's been a significant number of deaths as a result because of the fact that many of them have underlying health conditions as well.
Yeah, quality control. You have to have your processes very tight in order to protect your patients. And when you're in a clinic base in assisted living, for an example, if you don't have great standards that can protect the patients, infection rates can go up very significantly and very rapidly. In the homes, when COVID hit, if my patients don't receive, skilled care from my nurses, they have to go back to the hospital. Well, guess what? The hospitals were closed. So we went literally in chaos mode at the time that country shut down, and I was 24/7 on call with my entire leadership team. And all we did is prevent, and make sure that we're providing 100% support to the nurses that were willing to take the risk and the patients that were willing to receive the nurses at home, because that was another issue. Sometimes the mom and dad didn't want to receive the nurse because at this point you didn't even know what COVID was. But at the same time, if they don't receive the care, who is going to do the trach change? Who is going to do the things that the parents are not trained to do? And it was super challenging, I think. During chaotic times like COVID, you really understand the dimension of what leadership is. And it really challenges you not just to go above and beyond, but exceed that, because there is not a if, it is a must, and you have to be ready to.
So you're touching on something that is hugely profound. Talk about unprecedented crisis, and truly is, even in all of our time on Earth, where your whole business model is so heavily dependent upon safety. And here you're confronted with COVID potentially, and again, these senior citizens or the youth that are needing these services are highly vulnerable to diseases and infection and so forth. And then on top of the fact that back then we didn't have vaccines for those patients, let alone the frontline workers. How do you manage in chaos? You talked about, just being on the phone with your leadership team and the staff on a 24/7 basis. But if you look back, what were some of the things that really distinguish the ability to not only survive, but eventually come out stronger, maybe as a business and an organization?
Training. We went straight into developing short videos, for an example, on PPEs, on how to even wash your hands, how you wash your scrub. We went to education, because when you don't know what you do, you just try to prepare for the worst. And to prepare for the worst, you assume that the worst is going to happen. And so I had my director of nurses all over the states that we operate, literally making sure that the nurses are following protocols and ensure that if they have doubts or they have any questions, we're there to answer. We never let anybody hanging when it comes to, this is what's going on. And it was so chaotic, Scott, that the uncertainty is one thing that, when people are in chaotic mode, it's such a disheartening, because you want people to believe that is going to be a positive outcome, but it's not everybody that has that within. So that enforcement that, you have support, that enforcement, if you do the right thing, this is going to prevent infections. Is all you can do is cover your bases on really making sure that your people are well trained and they know what needs to be done.
At the onset of the interview, we talked about this notion of clarity and making sure that there was as least amount of asymmetric information, meaning that your staff and team have as much information. But in this case of uncertainty, where not only your organization, but really everybody in the system really didn't know what we were dealing with, how do you deal with that uncertainty to that extent? And still be able to just rely on training? But really, my follow-up question to that is, at that point, your productivity as an organization probably had to shrink in terms of available nurses who are willing to actually do the work, as well as the patients who are willing to see them. So your cash flow started to be affected. How do you actually manage this uncertainty plus the shrinking cash flow, not knowing how long this is going to last and if it's going to get worse?
You have to, number one, I am a firm believer that you cannot run a business with constraints of cash. So, and growth, they eat cash. So to me, to be in a position where I can provide a good environment, I have to have at least 3 or 4 months of cash flow in the bank all the time in order to secure that the business can be ran in the most effective way. The government on the other side gave us a lot of help when it comes to guaranteeing payment for the nurses that are being providing services in a timeline that was shortened than normally. So they were able to anticipate some of the funds in order for us to continue to operate. And at that point, think about the hospitals that were increasing pay rates significantly because of shortage of nurse. I don't have that privilege because I'm reimbursed by Medicaid. Medicaid doesn't approve increases of rate overnight like the hospitals can do. So you also have to really believe that you have a good workforce that's not just committed to your mission, but they're committed to the patients that they serve, that they're not going to leave the patients because the hospital is all of a sudden offering 3 times more than they're making. So it's continue conversations and make sure that they are receiving what they need in order to continue to be happy working for us.
So this brings up to the next conversation, which is around recruitment and turnover. And you bring up an excellent point, which is, given all things being equal, if the nurses can actually receive 2 to 3 times more pay elsewhere, why wouldn't they leave? And how do you retain them, and especially post-COVID, where labor shortage across all sectors have been affected? What are you doing to make sure that people are sticking around?
I think there's people that are highly driven by monetary reasons and compensation. There are people that are driven by, the sense of purpose, that they belong to a bigger mission and they like to work for a company that recognizes that. And we have always been very focused on recognition and also putting them first. When they know that you give the support and you really care for them, sometimes money is not all. And you're going to have 1/3 of your people that are going to be, the most important things for them is compensation, which is nothing wrong about it. But there's also, the relationship that you form with your employees that, they know I'm there for them. And I know they're there for me as well. So is that loyalty that speaks more than money.
So that loyalty is tricky, especially when the staff grows to, let's say, a fluctuating 1,200 nurses or whatnot. How do you deal with that? And you talked about earlier making sure that you have that one-on-one conversation with as many as possible. But how do you cascade down so that your lieutenants and the staff, directors, managers, and so forth are saying the same thing and maintaining those
Yeah.
relationships and the vision so that they feel loyal, they feel committed to this organization and the patients that they're serving?
Yeah, you just have to continue to train your middle management and making sure that you're having the right people in the right, seats. Hiring for me is I hire for attitude and I train for skills. So the first thing a leader has to be is the right attitude and have to buy into the mission, as much as I do. And if they do that, then they cascade down because everybody thinks the same way and are committed to the same values. And that is going to get down to the nursing level. Imagine you have the nurses and you have the supervisors, you have the directors, then you have your whole leadership, but everybody has to have alignment. Accountability is something that you create up front, not later on. So in order to create accountability, they have to buy in of what you're doing. And once they're committed to that, it's much easier to hold them accountable to make sure that they're doing the right thing.
Now, when we're talking about this kind of a service model, at the end of the day, it's about people,
Yes.
people that are working and people that are serving others. And there's a lot of qualitative aspects that are just difficult. It goes beyond skills, it goes beyond certification and designations. What do you do as an organization so that the people aspect is really cohesive as possible? And given the fact that a lot of these nurses also have very diverse backgrounds, including being educated abroad, maybe even coming from abroad or different perspectives and cultures, for instance.
Yeah, we do also a lot of testing, assessments, let's put this way, personality assessment to understand what's really important to them. And, even like I always say that to my people, just like, have you ever read the book, 5 Love Languages? And just understanding how they receive love and appreciation and care is fundamental. So if you start creating a process where you have, even in your software that controls the company and its operation, if you have on the profile of the nurse how she receives love. So the conversation can start by addressing that point, and the communication will also be focusing on how she's going to receive care and appreciation. And that's something super simple to do, but it takes a lot of emotional intelligence to understand that, once people really feels valuable, it's a game changer, because that's how you're supposed to be as a human being anyways. It's supposed to put people first. And we are in an organization that have a culture that do that. Otherwise, we will not be successful, especially on caring for medically fragile children. You have to care and you have to serve first.
So, Greice, I have to tell you, I am almost profoundly shaken in a way, because never in all my decades and decades of experience have I had a conversation about 5 love languages, which is typically in the context of marriage, Christian marriage relationship, being applied in a business leadership context. Because when people talk about performance reviews and meritocracy and skills, I think we talk about the things on a very quantitative basis. But what you're talking about is fundamental human condition and needs. And if you understand what those workers really need on a human level, they're going to feel more validated, respected, have dignity, and feel more rewarded in the work that they're doing, and which then is going to result in better service, loyalty, and so forth. So that is really profound. And then embedding that into the value chain and the systems and the processes, I think is pretty profound.
Yes. And if you think about it, it's something so simple. We're not talking about something that's complex. It's really taking the time to understand your employees. And as simple as it can be. And it really makes a whole difference.
Well, I wish it was that simple. If that was that simple, I think more companies would be doing it. But the reality is, I don't think they're really doing it at that level that you're talking about, where people are really understood and treated as really fundamental human beings that have certain needs beyond just money and rewards. 100%. Now, I want to ask a very basic question, which is, I know that at some point you exited. Private equity has taken basically a stake or ownership in the organization, and you are on the board, but not on the operational CEO level anymore. And having just this kind of conversation that we've had in the last several minutes, you've gone through pre-COVID, all the scaling issues that comes with a people organization, COVID, which is unprecedented, and then post-COVID, we got still huge labor issues. And then, of course, you're dealing with archaic and very slow programs like Medicaid, where cash flows and things and pricing just isn't as flexible as the private markets. So you've exited. Why did you exit? And then secondly, after you've exited, are you missing all these operational things, or are you somewhat relieved that you don't have to deal with all the stress on a daily basis?
I cannot be more grateful for the journey that God permitted me to do, from starting a company all the way to exiting. Having that operational experience is fundamental to any leader that understand the full circle. So when I decided to sell majority interest of the company, the main drive was really to have a partner that could help me to scale. And because it was my first time scaling a company, I had two options. I can buy expertise, or I can take some chips off the table and have a true partner that can help me to do things because they have done before and have the experience. If you find the right partner, I think that's the best way to do it, because then it's very collaborative. I exited as the CEO because I wanted to just do something different. When you're operating a company at that level, it's very stressful, and I felt like that I was not able to use my entrepreneurial thinking as much as I used to, because as you grow, the more discipline, the more complex gets to get. So it's more, I felt like it's better for a professional CEO if you find the right people with the right heart to do it than do it myself. And now I invest in startup companies. I am actually acquiring a stem cell business here in Florida that I'm going to create. I'm creating and developing a line of products on the stem cell, as well as the longevity and the rejuvenation side. So I'm super excited to create those verticals and help people to continue to live in a high quality.
Well, a true entrepreneur at best. It's been a real pleasure speaking with you. I've been joined by Greice Murphy, founder and board member of Advanced Care Partners. Thank you for joining today.
So much.
If you've enjoyed this episode, take a moment to rate our show on any podcast platform that you listen to. Scroll down to the bottom and push 5 stars. It's that easy. And as always, thanks for listening.